Hi, I'm Subrat Banipati and I'm a physical therapist and I'm treating chronic pain for approximately 32 years. And I'm creating this content because of my other patients and followers. So, whenever I see any patient, they tell me, they have pain. So, then if I ask how long it is going on, and they describe few things, then also I ask, do you have chronic pain? And most of the time, they will say no. And this is a good point, and this is a great point to understand and remember if you are trying to follow me. So, people they are talking about, they do not have chronic pain because probably they think chronic pain itself is a diagnosis, or they think there are certain diagnoses are related to chronic pain, like for example, fibromyalgia, maybe a polymyalgia, or what we call as a myofascial syndrome. So these are different names are there. So when I was going to school, almost like 33, 34 years back, so that time many of these names I didn't even hear. And this is my whole point of making this video, so that you will be able to understand and don't get stuck with different kind of name. So again, whenever I talk like this or talk about this, sometimes that can make some people maybe upset because they always believe, and and I don't blame them because I treat these women all the time. So they have been kind of ignored, or there will be going to a physician who is going to say, well, I don't believe in that diagnosis, or I don't think that is something called as fibromyalgia. I don't believe that. I am taking the belief out of the system. So I'm not, I'm just talking about the science, the fact, what we know. Unless we know the facts, we can go round and round and round, but nothing much is going to happen. So, coming back to chronic pain, yes, people relate chronic pain to certain kind of diagnosis, or sometimes they think chronic pain itself is a diagnosis, but it is not actually so. It is very simple. So, if you have any pain, I don't care. It can be your shoulder, it can be your neck, maybe a headache, maybe a knee pain, or in a back pain. So, any pain, any part of your body, if you have that and you have it more than 12 weeks, approximately 3 months. So, as long as you are having, it does not have to be continuous, it can be off and on. And you are having that, even though you are getting treated, it does not matter what kind of treatment you are taking. You may be taking medication, you might have injection medication combination, you might be doing something natural, it does not really matter. As long as you have pain more than 12 weeks, we deem to be consider that as a chronic, period. So if you don't have a diagnosis, does not matter. If you have a diagnosis, it does not matter. And if you have noticed, if you have one diagnosis, you go to a different physician, they will add on more diagnosis. So at, like, if you are suffering with pain for 6 months, 7 months, 8 months, so maybe it started with maybe a shoulder pain, or you feel whole body stiff, something like that. And then you'll probably have a diagnosis, you say you are very tired, because most of these diagnoses, as it is not very well understood, they are going to put a name to it, just to because you are the one who is looking for solution, you want to know what is going on with you. So you'll go there and you keep asking what is going on with me. So if you are complaining that you are tired all the time, but there is no taste, and I'm going to cover all these things in my subsequent video, and it's going to make more sense. Now, you don't have any other thing, you just feel tired. So there is no taste or anything to show that you have an infection, you have this, you have that. So according to your symptom, you will be diagnosed as chronic fatigue syndrome. So then you have a different criteria to diagnose, uh, if that, depending on the physician, if they believe in the diagnosis or not. They say, well, you have fibromyalgia or polymyalgia, depending who you are going, what they're saying, they are giving up all these names. So these are all come under the umbrella of chronic diagnosis, chronic pain. So sometimes you might not have pain, you just have swelling. So then they will diagnose you as a chronic venous insufficiency. So chronic means things are going on with you for some time, and it is more than 12 weeks or 3 months old, and it did not happen yesterday, or maybe last 1 week, maybe in last 1 month. Why the chronicity of any problem, including pain, is important? That is exactly what I am going to explain in my upcoming videos. Because what I have noticed when the patient come to us in our clinic, so when they have some understanding, some idea, it became very easy. Otherwise, they will come here, they will ask me, hey, I have this diagnosis, fibromyalgia, what is going on with me, and how I am going to fix it. So that is usually the question. And if we are not asking the right question, we are neither going to get the right answer, neither you are going to get to the right solution. So if you like this video, please share, and you can share with your friends or family who is suffering with it. I make content for this. This is actually, I do it because many of my patients, they keep telling me, you need to produce this kind of stuff because it is important for every one of us who is suffering. They need to hear and understand. So thank you for watching. I'm going to come up with another video